Welcome back, everyone, to the show. It is World AIDS Day, and President Biden plans to unveil a new national HIV/AIDS strategy aimed at ending the epidemic by 2030. It will prevent new infections, improve outcomes for people living with HIV, and reduce health inequity. It prioritizes Black women, trans women, people 13 to 24 years old, IV drug users, and Black, Latino, and Native American men. An administration official says that Biden plans differ because it's a, quote, whole of government approach and recognizes racism as a serious part of the health threat. New findings say that HIV rates dropped significantly for white men who are gay or bisexual over the past decade. The CDC reporting infections fell from 7,500 to 5,100 from 2010 to 2019. During that same time frame, infection rates for Black gay males inched downward but rose significantly for Hispanic and Latino men. Researchers say a lack of access to treatment and perhaps the stigma of being gay males play a factor, or being gay may play a factor for the men who did get infected. Overall, Black people account for a higher portion of new HIV diagnoses and people living with HIV compared to other races and ethnicities. Additionally, a younger demographic of people ages 13 to 29 now making up a disproportionate number of new HIV infections. A new collaboration between the Grapevine and ViiV Healthcare aiming to level up the conversation on HIV in the Black and Latinx community. It targets millennials. So let's welcome to our show now, here to Morning Hype, PJ Moton-Poole, who is the Senior Manager of External Affairs North America at ViiV Healthcare. PJ, how's it going for you on this World AIDS Day?
Hi, good morning. It's a good day. It's going to be a busy one, though.
For sure. So first off, just tell us a little bit about some of those statistics that we talked about in terms of the HIV community today.
Yeah, namely recognizing that HIV rates for white communities has significantly decreased, and they really have grasped a hold of the epidemic within their communities. And what we know is that we've traditionally carried the burden of the HIV disease state within Black communities, namely with Black, gay, bisexual, and same-gender loving men carrying the highest burden. And now we're seeing an increase in Black women. We know that it's going to take us to save us. And so with that being said, we are excited that the Biden administration is prioritizing these communities, and we're going to continue to do the work that we need to do to ensure that our people are receive the care that they need and deserve.
Okay. Tell us about your company's plan of attack, right? We know sometimes in politics they can just be words with little action, but your company actually going to be helping to hopefully get some change, right?
Yes, absolutely. So ViiV Healthcare is the only pharmaceutical company that is solely focused on HIV as a disease state. So that's the one thing that makes us uniquely set apart from some of the other companies. We get the opportunity to not only have innovative technologies and medical advancements, but also really deeply and meaningfully engage communities in a way that ensures that the voice of people living with HIV is brought to the forefront, and they are receiving the care that they need from the healthcare system, that they are receiving the advocacy that they need from the government, that they are receiving the supportive services that they need, because we know that HIV doesn't exist in a silo. It has everything to do with one's geographic location, with their education, with all of the social determinants that might increase or decrease one's risk. So at ViiV Healthcare, we really focus on all of those things and look at whole person health to ensure that people are receiving optimal health outcomes.
And we understand also that there's a partnership with the Grapevine as well. And a new episode is HIV still an issue in the Black and Latinx community. And I understand it covers some of your own experience with the disease, right?
Yes, absolutely. So as a Black queer man living with HIV, I had the pleasure of joining a dynamic group of individuals in which we talked about how HIV stigma looks in the Black community and its impact on people receiving the care that they want and need. The Grapevine is an amazing YouTube show that targets the millennial community. And so I was really proud to kind of to be a part of that panel and to bring that conversation to life.
And where can people check that out?
So that's available now on YouTube on Grapevine TV. Just search Grapevine TV and you should see it pop up. And it's one of the newer episodes, so you'll see it pop up there at the top. It's one of their newer episodes since they've been back online.
And I think we actually have a little clip of it that we want to share, so let's take a look.
Think about so many films, so many documentaries, so many TV shows that hold space for folks living with HIV. Seldom do I see myself reflected. And then that becomes a subconscious message that, oh, my story, my health, and my life does not matter.
So, PJ, what do you think, what is the mission and the message? What are you hoping, you and the other people that were involved, what are you all hoping people will get from this?
Well, one of the things that I think that is important to recognize is that HIV is a disease state that impacts the body, but even more importantly, stigma is an additional disease that really impacts people's minds and really impacts their ability to receive the care that they need, whether it be distancing themselves from HIV organizations or people living with HIV for fear of people associating them with the disease state, whether it be misinformation around what HIV means today versus what it meant maybe 40 years ago, or even what it might mean for somebody for their family to find out more information about their sexuality or something like that. There's a huge package of stigma that really becomes kind of the barrier as it relates to some people receiving care, specifically in the Black community. And so that's one of the things that we really work to kind of undo, is that silent killer that is the stigma associated with people living with HIV.
All right, PJ Moton-Poole, we appreciate your time and your expertise on this topic. Thank you so much.